Joining us today is Elle Tam, who is the Clinical Director and Nurse Administrator, I guess I'm saying that, at Premier Ambulatory Surgery Center. Thank you for joining us.
Thank you for having me.
Glad to have you here. I managed to get ambulatory out. I'm surprised.
You did?
That's a good thing for me. Talking about the Ambulatory Surgery Center, when did you open?
We opened in 2018 and went on par with insurances in 2019 and started seeing patients.
And give us an idea what an ambulatory center is.
We do day surgeries. You come in, it's for a short period of time, and perform your case, and you go home in the same day, usually within a matter of a couple of hours.
So does that mean that you handle cases that are previously scheduled, right?
Yes.
I mean, so it's not an emergency center or something of that nature, right?
No, it is not. We're able to handle an emergency, but we don't have walk-in clients for treatment.
So what kind of, procedures are we talking about?
We do cataract surgeries, we do GI services, gastroenterology, endoscopy, colonoscopy.
You're covering us from head to toe, basically.
We are.
That's good to know.
Safely.
Safely from head to toe. What differentiates you from other clinics or maybe from going to a hospital, for instance?
Well, we have all new equipment. We have board certified surgeons, and all of our nurses are trained. We have deem status with the New York State Health Department, and we're efficient. You're not going to spend your whole day doing your screenings or your surgery. You're going to go in safely and be discharged the same day.
What does deem status mean?
It means you've gone through rigorous surveys and you've passed, and you are able to perform your cases safely and without complication.
How do you convince people not to be nervous when they're going to have a procedure done? I hate to say this, but for me, and maybe I'm not the typical individual, the anticipation is 10 times worse than the actual procedure itself.
Well, you're greeted by a nurse when you come in, and she takes care of you in pre-op, so it's one-to-one. So we're never at a level where the nurse can't get back to the patient to answer questions or to offer comfort, as well as qualified care. So we're one-to-one, and at the most, a pre-op nurse, she has a patient, finishes, answers questions, and she's able to move on comfortably to the next case.
And what kind of qualifications, when you're hiring people to work at the ambulatory center, what kind of qualifications do you look for?
I look for prior experience, so they're familiar with the efficiency of an ambulatory surgery center. I like them to be ACLS qualified and have an infection control background. Was
COVID difficult for you folks?
Well, we did do cases that were emergent or necessary, medically necessary, but no, I still have the same staff as I had from 2018 until now.
Is it still exciting for you and for your staff to go to work each day?
It is. We work very well as a team.
You know, you were telling me the fact that you may spend 10 to 12 hours
Yes.
in an ER or something like that. I can't even imagine. You know, doing a 7-minute interview for me under bright lights seems difficult, right? But you're dealing with something like this, and I think that maybe oftentimes we don't give credit where credit is due. And, and I'm talking about people such as yourself and the people that are working for you. They're like kind of the first line. You know what I mean?
Yes.
These people are people that have been doing it year after year after year.
True.
And does your staff constantly have to be recertified?
We do take our ACLS every 2 years, and we do continuing education and infection control. But we're a group of people that enjoy working together, and we enjoy what we do. So,
do you constantly look for individuals to help out, or new individuals for staff? What happens if somebody retires?
As we grow, we do hire, and we started out with a small staff, and now I have 15 nurses that work, 3 surge techs, 2 reception staff. So it's we're always willing to hire as we grow, and people stay.
And how long have you been doing this?
44 years.
God bless you. That's great. So you started when you were 1.
I
Good for
did.
you. That's good. Elle, thank you very much. We really appreciate you joining us.
Thank you.
For more information and answers to your questions, have your physician contact Premier Ambulatory Surgery Center or call 716-898-2100.
Sponsorship and promotional consideration for the preceding segment was provided by the following. Thanks for watching this edition of the Big Wack Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigwack.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to the Big Wack, Buffalo's oldie station.